Your liver might be quietly crying for help and you wouldn't even know it. It's the body's silent multitasker, working 24/7 to detoxify your blood, produce vital proteins, help digest fats, and regulate hundreds of critical functions. But here's the twist. When the liver begins to struggle, the signs are subtle. So subtle, they often get mistaken for everyday fatigue or minor digestion issues. By the time liver disease shows up in bold letters, the damage may already be advanced. So in today's video, we dive in deep into the 12 early warning signs of liver disease that you should never ignore. If you spot even one of these red flags, your liver could be sounding the alarm. And stick around till the end, because the last symptom is one most people overlook entirely, yet it can signal serious liver damage. Let's get started. The first sign might show up not in your abdomen, but on your skin. If you've noticed a persistent yellow tint in your eyes or skin, this isn't just a cosmetic issue, it's jaundice. Jaundice happens when your liver can't properly filter out bilirubin, a yellow pigment formed when red blood cells break down. When bilirubin builds up in your bloodstream, it stains your skin and the whites of your eyes. You might also notice darker than usual urine or pale-colored stool. These are early indicators that your liver's filtration system isn't working as it should. This doesn't mean you're in immediate danger, but jaundice should never be dismissed. It's your body's way of signaling that something is wrong with your liver function. Moving on to the second, unexplained fatigue. Sure, everyone feels tired sometimes, but if you're feeling constantly drained, no matter how much rest you get, your liver might be the culprit. The liver plays a crucial role in metabolizing nutrients and producing energy. When it's overwhelmed or inflamed, your energy levels plummet. You may find it difficult to concentrate, stay alert, or maintain motivation. What makes this symptom tricky is that fatigue is so common, we often chalk it up to stress, poor sleep, or just getting older. But persistent fatigue, especially when combined with other symptoms, can indicate that your liver isn't converting food into fuel the way it should. The third sign to watch out for is abdominal swelling, particularly in the upper right quadrant of your abdomen where the liver is located. If your belly feels bloated or this could be a sign of liver inflammation or fluid retention, known as ascites occurs when fluid leaks from your liver into your abdomen. Due to high pressure in the liver as blood vessels, a condition known as portal hypertension. You might notice your clothes feel tighter around your waist, or your abdomen feels full and heavy. In some cases, this swelling becomes visibly lopsided, or comes with discomfort when sitting or lying down. Now let's talk about something you probably wouldn't associate with liver disease: itchy skin. That's right, the fourth warning sign is persistent itching, especially without a visible rash. When your liver isn't functioning properly, bile salts can accumulate in your bloodstream and deposit into your skin, causing intense itching. This can affect any part of your body, but often shows up on your arms, legs, palms, or soles. Many people try treating this with creams and antihistamines, not realizing it's an internal issue. If you're scratching more than usual and can't find an obvious cause, your liver might be involved. Our fifth sign might show up in your digestive system. Nausea and loss of appetite are commonly overlooked symptoms of liver distress. If your liver is inflamed or congested, it can interfere with the production of bile and disrupt your digestive process. You may feel full after eating small meals or even lose your interest in food entirely. Over time, this can lead to weight loss and nutrient deficiencies, which further weaken your immune system. It's important to pay attention to your eating habits. If your appetite suddenly changes and you experience ongoing nausea, don't dismiss it as just a stomach bug or stress. The sixth sign is dark-colored urine. While hydration levels can affect the color of your urine, consistently dark urine, especially if it's tea or cola-colored, can signal excess bilirubin in your system. Again, this ties back to jaundice. When the liver struggles to process bilirubin, it spills into the bloodstream and exits through the kidneys. This warning sign is often the easiest to notice, but also the easiest to ignore. People tend to hydrate more and assume it's solved. But if the dark urine persists, despite drinking enough water, it's time to dig deeper. Our seventh sign is related to the blood easy bruising and bleeding. The liver produces proteins necessary for blood clotting. When it's damaged, your blood's ability to clot is impaired, making you bruise more easily or bleed for longer, even from minor injuries. Have you noticed frequent nosebleeds or gum bleeding? Tiny, purple or red spots on your skin called These are small but crucial indicators that your liver's clotting ability is compromised. And while they may seem harmless on the surface, they point to deeper imbalances in your liver's functioning. Number 8 might surprise you. Hormonal imbalances. In people with chronic liver disease, estrogen levels can rise due to the liver's reduced ability to metabolize hormones. This can lead to symptoms like gynecomastia, breast enlargement, and many regular menstrual cycles in women, and even mood swings or depression. These hormonal shifts aren't random. They are your body's way of reacting to a compromised liver that can no longer regulate hormone levels efficiently. If you or someone you know is experiencing unexplained changes in sexual function, body hair patterns, or emotional stability, it might not not just be hormonal, it could be hip. The ninth sign brings us back to digestion, specifically pale or clay-colored stools. Your stool color is influenced by bile, which is produced in the liver. Bile gives stool its characteristic brown color. If your stool is consistently pale, gray, or chalky-looking, that could be a sign your liver isn't releasing enough bile into your digestive tract. This often goes hand in hand with other symptoms like dark urine or abdominal discomfort. While one odd-colored bowel movement isn't a cause for panic, a pattern of pale stools should raise concern and prompt a visit to your healthcare provider. The 10th sign is swelling in the legs and ankles. This symptom, like abdominal swelling, is due to fluid buildup caused by a malfunctioning liver. When blood flow through the liver slows due to scarring or cirrhosis, it causes pressure to back up in the veins, leading to swelling in your lower extremities. This condition, known as peripheral edema, often worsens throughout the day or with prolonged standing. The swelling might not be painful, but it can be persistent and difficult to reduce with typical remedies. If your socks leave deep impressions or your ankles look unusually puffy, it's time to pay attention. Our 11th sign is brain fog or mental confusion, what doctors call hepatic encephalopathy. When the liver fails to filter toxins effectively, they begin to accumulate in the bloodstream and eventually reach the brain. This leads to confusion, poor concentration, memory lapses, and in severe cases, personality changes or tremors. You may struggle to find words, forget appointments, or feel like your thoughts are constantly clouded. This is one of the more advanced signs of liver disease and indicates that the body is becoming overwhelmed by unfiltered toxins. It's a subtle but dangerous red flag. And finally, we arrive at the 12th and most often ignored symptoms. These are small spider-like blood vessels that appear on the skin, usually on the face, neck, upper chest, or arms. They form when blood vessels beneath the surface dilate due to hormonal changes triggered by liver dysfunction. While they can be harmless and appear in healthy people, especially women, a sudden increase in number or size, especially alongside other liver-related symptoms, can signal trouble. Think of these tiny red marks as warning lights on your skin, quietly trying to tell you something important. So, what should you do if you recognize more of these signs in yourself or someone close to you? Don't panic, but don't ignore them either. Liver disease is a progressive condition, but it's also one that responds well to early intervention. The key is awareness. Many forms of liver disease, including fatty liver, hepatitis, and cirrhosis, can be managed or even reversed through lifestyle changes, medication, and timely medical care. The worst mistake you can make is brushing off these signs as something trivial. Your liver won't always shout for help. Often, it whispers. Now you might be wondering, what are the risk factors that put your liver in danger in the first place? Well, a high sugar or high fat diet, excessive alcohol consumption, obesity, type 2 diabetes, certain medications, viral infections like hepatitis B or C, and genetic conditions can all contribute to liver damage over time. If you fall into any of these categories, it's even more critical to watch for early symptoms. But here's the good news. The liver is one of the most resilient organs in your body. It can regenerate damaged tissue and recover much of its function if you catch the signs early and act quickly. So here's your takeaway. That extra itch, the unusual fatigue, or that yellowish tint in the mirror could be the early signals your liver is trying to send. Don't wait for a medical emergency to find out your liver needs help. Prioritize regular checkups, eat liver-friendly foods like leafy greens, garlic, and beets, and avoid over-the-counter medication abuse. You owe it to yourself to protect this vital organ. If you found this video helpful, please consider giving it a thumbs up and sharing it with someone who might benefit. And let us know in the comments, have you experienced any of these symptoms before? Your story could help someone else. Spot the signs early. Thank you for staying with us till the end. If this video helped you understand the silent warning signs of liver disease, don't keep it to yourself, share it with your family and friends. Early awareness can save lives. And if you're passionate about protecting your health and learning more about how your body works, don't forget to subscribe to our channel. We break down complex health topics into simple, actionable insights. So, hit the like button, leave a comment below with your thoughts or experiences, and click the notification bell so you never miss a video that could make a difference in your life. Thanks again for watching, and we'll see you in the next one. Stay healthy, stay informed.